Sorry, it takes a minute to set up technology. Super fun. Come on. Okay, we are live.
Awesome.
I'm going to go ahead and switch the hosting over to Allison, and we're all set. Participants. Allison, make host. Okay.
Okay, great. Thank you everyone for joining us today. I'm Allison. I am the president of the Endometriosis Foundation of Houston. And today we are happy to welcome Dr. Jessica Drummond to speak to us. She is going to be discussing nutrition strategies for endometriosis symptom relief. Dr. Jessica Drummond is the CEO of the Integrative Women's Health Institute, and she is the author of the book Outsmart Endometriosis. She holds licenses in physical therapy and clinical nutrition and is a board-certified health coach. She has 20 years of experience working with women with chronic pelvic pain, facilitates educational programs for women's health professionals in more than 60 countries globally, and leads virtual wellness programs for people with endometriosis. Dr. Drummond lives and works with her husband and daughters between Houston, Texas, and Fairfield, Connecticut. She was educated at the University of Virginia, Emory University, Duke Integrative Medicine, and Maryland University of Integrative Health. Thank you for joining us, Dr. Drummond, and I will turn it over to you.
All right, thanks so much for having me. I'm going to go ahead and share my screen so we can look at the presentation together. And I think I'm going to turn off my camera because I've been having a little bit of internet issues today. We have a storm going on. I'm currently in Connecticut, which is why I'm not. I hear it's sweltering in Houston right now. Is that true? Yes. In my office, we have like a breeze and I'm wearing a sweater, but that's just changed with the storm. All right. So we're going to talk about my approach to using nutrition for endometriosis support and symptom management. And I think it's a little different than you might have thought of in the past when we're thinking about, what is quote unquote the endo diet. So let's dive right in. So what we're going to talk about is how to prioritize your day-to-day habits to support your endometriosis symptom relief and healing, your key support team, pre and post excision surgery, if surgery is something that's appropriate for you, and how through the whole process, we're considering preconception health, if post excision or without excision, fertility is a goal for you. We'll always be keeping that in mind as well. And I know all of us are busy, and I hear that in Houston, some of the digital homeschooling starts tomorrow. So one of my friends is actually of moving. So I can completely understand if you're only half listening, but you will get the most out of it if stay here. And I'm going to try to keep it relatively brief and to the point of your questions. So where do we begin when we think about how to use nutrition and lifestyle medicine to support and reduce the symptoms of endometriosis? So first of all, it's to think about, are the symptoms that I'm really experiencing, are they actually driven by endometriosis, being made worse by endometriosis, or are other systems actually making the endometriosis symptoms worse? So for example, if you have digestive discomforts, some of that can be driven potentially by having endometriosis growing on and around the small intestine or near the ileocecal valve or on the large intestine. But also, if your digestive function is not optimized, even if you don't have endometriosis on your digestive tract directly, that can irritate endometriosis lesions that might be, outside the ovaries or behind the uterus or somewhere else in the peritoneal space. So sometimes as we improve the functioning of these other systems, digestion, nervous system, immune system, it can irritate less endometriosis symptoms. So that's really encouraging. How to get a diagnosis. Now, we can't use any of our functional nutrition lab testing to diagnose endometriosis. What we're doing instead is we're looking at is the functioning of the digestive tract, the gut microbiome, the vulvovaginal microbiome, the brain neurotransmitters, and some of the immune markers. How well is that all working? And so that's kind of the, diagnosis is really a strong word, but that's sort of the assessment and tools that we're using along with history to see how these symptoms are impacting our endometriosis, symptom experience. Obviously, we all know here, endometriosis can only be diagnosed surgically, but we can use some assessment tools to keep refining and improving the systems that are really involved in whether or not your endometriosis symptoms are worse, and potentially even making the endometriosis itself worse. And if surgery is appropriate for you all will be talking to surgeons during some of your other meetings, but just because we can sometimes completely eliminate all the symptoms by taking this approach, one thing that we may not be able to be impacting is fertility. So even if all of your symptoms are completely resolved using nutrition and lifestyle medicine, it still may be really appropriate to have a surgical consult, especially if you have some kind of fertility goal. So my perspective with everything we do here at the Integrative Women's Health Institute is to not stay specifically focused on symptoms, although what those symptoms are and where they are can be informative to the assessment. Our goal is to optimize each of those physiologic systems, digestive, immune, and nervous system primarily in this case. So a lot of times people come to me with the question, so what is the endo diet? What should I be eating because I have endo? And that's actually the wrong question. What we want to be thinking is my personal, most supportive nutrition plan for my genetics, my pleasure, to help me feel well and less symptomatic, to reach my functional goals, and for my overall health. Because it's not really about the diagnosis, it's about the person experiencing the diagnosis and all of the other factors that are involved in her overall health. So to give you a bit of my story, I was a total nerd in high school and actually my whole life, still am. And so I was a really kind of type A person, really very kind of driven, burning the candle at both ends. I went to physical therapy school and specialized in orthopedics and women's health pretty quickly, always with an interest in kind of female athlete health, perinatal health. And I did work with a lot of pelvic pain, as early as about 3 years into my practice. And I noticed that a lot of my patients were a lot like really go-getters, pushing through the pain, learning to just deal with the pain, pushing the pain down. And that's how people have to live when you're living with chronic pain and chronic issues. And I had an experience myself after my oldest daughter, the redhead here, Claire, was born. It triggered a reactivation of Epstein-Barr virus, and I was really sick for about 4 years, hormonally and immunologically. So once I understood what had happened to me, I began to test, what if changing my nutrition to help my own hormones could help the people that I was working with chronic pelvic pain as a physical therapist who didn't have full resolution of that pain, where we would kind of hit the wall. And so I tried that just empirically in clinical practice for a while. And then I went back to school and got a doctorate in clinical nutrition from a functional medicine standpoint. And, years before that, I had started the Integrative Health Institute because I knew that something was going on there that I could help my patients with pelvic pain think broadly about how their day nutrition and lifestyle could really improve the pain. And for me, it dramatically helped fertility. My two kids are 7 years apart because I struggled with secondary infertility. And once I optimized all those systems, for me, it was digestive, immune, and endocrine, my hormones. It was much easier to get pregnant with the second baby, Kate. She's the little blondie they're all teenagers now. Kate's almost 10 and Claire's 16. And so I began to focus my nutrition practice and coaching practice, kind of helping people implement these things, because I've done it myself. I know that's not that easy to eat really clean all the time. When I was a physical therapist, I didn't know how to cook at all. I didn't know how to cook in college and graduate school. My mom didn't cook. I had to learn all these new tools. I had to prioritize self-care. So I know how difficult it can be to actually change so much, how it impacts your social life, and, just eating differently is a big impact. So that's why I combine nutrition with health coaching. Now, I want to show you a quick example that I experienced just yesterday, which was so useful to this letter. When we stop thinking about the endo diet and we think about optimizing our nutrition and lifestyle to support our overall health, digestively, neurologically, immunologically, and to some extent, even with hormonally, there are increasing ways that we can actually measure this. So one of the things we do in our endometriosis coaching program is we have people use like fitness trackers to assess heart rate variability and sleep quality. One of the fitness trackers, one of the Garmin's that some of our clients use, that you can use a number of different fitness trackers to do this, but this is an example from a Garmin Vivo Smart 4. It gives you, so heart rate variability is an objective measure of stress that looks at the change in time between your heartbeats. So we would think like, okay, if I'm at a resting heart rate of 60, all my heartbeats are X number of milliseconds apart. But that's not 100% true. There's actually slight millisecond variability from beat to beat to beat to beat. And the more variable that is, some are a little closer together, some are a little further apart, the more stress resilient or the less stressed you are. So you actually want a higher heart rate variability to show that you're less stressed. So the way that the Garmin measures this is through a tool called the body battery, and it uses heart rate variability. It also uses like just resting heart rate. It looks at some sleep metrics, and it comes up with this body battery. So ideally, you wake up every morning at 100. Your body battery is full. You've had a great night's sleep. You've got plenty of energy. You feel good. You're not in a lot of pain. Your heart rate variability is pretty high. Lots of stress resilience. Now, if you look at this graph down here, this is kind of the full day. Blue is times of calm, and orange is times of stress. But stress is not always a bad thing. Stress is sometimes like you were recovering from a workout. Like whenever there's a little space like this, those are workouts. So there's usually some orange after that, because that means like you're recovering. Like I went for a swim here. I probably went for a walk over here. And then there's some like exercise recovery. That's a good thing. That gives you that's some stress, but it's a good kind of stress. Sometimes you're just working really hard and enjoying your work. That can be stress, but that's a good kind of stress. Blue means you're in that recovery, mode. So at night, so this is like midnight to 8 a.m., pretty much mostly in the blue. There might have been some recovery from the day before's day, but that's mostly blue. a workout, a little recovery, mostly blue, a little bit of orange because you're working or whatever. Workout, recovery, blue. That's what a healthy day looks like. Does that make sense to everybody? And then for me, the next day, same thing, started off well. There was a little break here only because I charged up the watch, so didn't collect any data there. And then had a couple, yesterday I walked like 8 miles a couple different times. So there was more exercise, recovery, took a nap, you know, so it was pretty chill. Then I went out and I did an experiment. I am a really clean eater. I eat very little fried food, almost no gluten. Last night I ate fish and chips. So gluten battered fish and French fries. And I had 2 glasses of wine, which is way more alcohol than occasionally I drink a glass of wine, let's say once a week most, but probably really less than that. So my body battery, this was measured in the middle of the day, but generally speaking, wake up at 100, doing well, exercise, it comes down a little bit, but not too far. I go to bed charged up. Last night I ate fish and chips and 2 glasses of wine, went to bed at the normal time, but my body couldn't recover. Look at how stressed it was all last night. My body battery actually went down during sleep. I only woke up at 47. Now, actually I woke up at 35 because I looked at my watch here and I was like, oof, because I knew that was not good. So I spent a couple hours doing recovery strategies. I ate beet juice and cucumber juice and tons of vegetables and good quality protein for breakfast and lots of hydration and minerals, and rested this morning. And I was working a little bit here and just kind of moving, and that's just kind of general day stress. That's fine. But I actively recovered here, knowing what had happened. And I wanted to show you guys that because that's so useful that we now have tools that can show us, you know, and I knew that was going to happen. I mean, you know, I'm eating this way for 20 years, but it's so useful to be able to see it in you know, a very clear way, and also to see when your recovery strategies are working and building you back up. So between, you know, when I woke up this morning at 6 something and started working at noon, my body battery was increased 12 points because I was actively recovering. So we can now use tools like that, to see what is the right, not just food plan, but sleep strategies, mindfulness strategies, connection strategies, and so forth. So that's a great, fun example that I will remember not to eat that way again for a while. All right. So what I started to realize through my own illness is that optimizing hormone balance naturally is really important, but you can't just optimize and balance hormones like from the top by giving people estrogen, giving people progesterone. You really want to help the system balance the hormones from the inside out. And while endometriosis is not cancer, from a functional nutrition standpoint, it behaves like some cancers and other inflammatory conditions like Alzheimer's disease. Plus, it has the components of musculoskeletal pain, some hormonal imbalance symptoms, digestive and immune symptoms, and nervous system symptoms like fatigue and anxiety that I had to address myself. So I brought all that experience back with me to my training and the research we started to do. So now for your personalized approach to figure out the best food and lifestyle plan for you, the first thing that we're going to check is how healthy is your digestion? Are you eating a clean diet, you know, not mostly French fries and fried fish and wine and gluten? The fish is good. That was about the only good thing yesterday. And how well are you absorbing that nutrition? And then from an immune standpoint, is there any kind of autoimmune picture? Do you have other autoimmune comorbidities like hypothyroidism or celiac disease or some preclinical autoimmune markers? Are there elevated inflammatory markers, either in the gut or in general? Sensitivity to things like oxalates, bladder pain sometimes goes along with that, any histamine sensitivity symptoms, and so forth. And then how is the nervous system responding? And this we can measure with heart rate variability, like I just showed you. And we also want to be focusing on adding signals of safety to the nervous system. So when I eat fried food and drink too much alcohol, that's a danger signal to my nervous system. We saw it in the nervous system response. So that's going to impact potentially, pain, fatigue, and other symptoms. And obviously we're doing all of this in the context of skilled excision surgery and specialized physical therapy. So the food plan can to some extent vary, because it'll vary a little bit based on your genetics. One clue to help us figure out where to begin is your genetics. So a kind of general healthy diet, we think about Mediterranean diet, whole grains, mostly vegetables, some beans, a little bit of meat and fish, healthy fats. That's kind of the midpoint of healthy nutrition. But you can have a very healthy vegan diet, kind of all the way to one side of the equation. You can have a healthy ketogenic diet. You can have a healthy vegetarian diet. You can have a healthy paleo diet in between. So anywhere along that spectrum, you could have a diet that's serving you. Mostly plant-based, very nutrient dense, low inflammation. You're varying your protein sources. Some are more animal protein, some are more vegetarian protein, more or less grains. But all of those are whole foods diets that can be healthy for different people. If you have a blood type of O, you'll tend to have the genetics that's more supportive of the side of the equation that's paleo keto. If you have a blood type of A, you're more likely to do better with a more plant-based, less animal-based diet, so the vegan, vegetarian. But unless you have more autoimmune comorbidities, then beans and grains can be a little bit challenging. If you have more cardiovascular issues, even if your blood type is O, you may not be able to tolerate certain kinds of animal protein. We'll have to be more careful there. And depending on your level of stress resilience, you may be less low carb, might be better for you. But those are some guidelines where we can begin. So we'll start with thinking about what are the foods we want to add. Now, most people, not just with endometriosis, but with any pain syndromes, with any autoimmune syndromes, with any inflammation, any metabolic issues, and really probably most people in general should avoid dairy, gluten, sugar, all sweeteners, and soy as much as possible. But again, there may be even some of those that you may be able to tolerate with optimized digestion. So we're going to consider how to add the foods that are going to be most nourishing to you.
May as well.
And so those foods that everyone is going to add are mostly vegetables. There's a slight caveat with nightshades if you have a lot of autoimmune issues or a lot of joint kind of musculoskeletal pain, then we might test to see if you're sensitive to nightshades. But most people need to add vegetables, about 8 to 10 servings per day. Most people with endometriosis need to add fats to help with stress resilience and hormone balance. And then most people need to think about digestive functioning. So when we're talking about addressing leaky gut microbiome dysbiosis, and motility challenges, how is the digestive tract working? No matter what the food plan is, are you chewing? And ideally 20 to 40 times per bite? Are you eating slowly and calmly? Do you have enough stomach acid? Enough digestive enzymes? Do you have good digestive motility? Is there any kind of bacteria, fungi, or other microbes in the small intestine? Any bowel movement challenges like constipation or diarrhea, or anything else that would point to imbalance in the gut microbiome? A lot of times there are some really simple things we can do. Are you absorbing enough nutrients, enough hydration? Do you have a daily bowel program to help you get that good quality Bristol 4 bowel movement each day? Sometimes people are just lacking minerals, lacking hydration, lacking a routine. So basically from mouth to anus, we want to be focusing on the digestive tract function. And I generally start there because unless your digestion is working well, any other supplements you take for the nervous system or the immune system or any foods you eat, are not going to be well absorbed anyway. And then when we're thinking about the immune system, so the small intestine is the barrier between your digestive system and your immune system. You want that to be a really healthy, semi-permeable barrier. You don't want everything to go through that, and you don't want it to be inflamed, but you want nutrients to be able to get through it. So some nutrients like glutamine, zinc, demulcent herbs, collagen, or just amino acids in general, berberine. There are lots of things we can do to help heal the lining of the small intestine, which is really important if you have leaky gut, have bloating, or you struggle with any immune issues. We can also sort of quote unquote kill off the bacterial or fungal overgrowths using antimicrobial herbs. However, one caveat with endometriosis, if you have that bloating, that quote unquote endobelly, which is usually SIBO or SIFO, sometimes that is driven by the disease itself. There may be some adhesions or some endolesions growing on or around the small intestine that slow down the motility and that create little pockets where these aberrant bacteria and other microbes can grow. So until we address that motility issue, which we can do to some extent with physical therapy and supplements, but sometimes that might not fully resolve surgery, we're always going to be sort of managing SIBO rather than quote unquote treating it. We also want to consider the absorption of anti-inflammatory and antioxidant supplements and just nutrients in the food, and support for the mitochondria to give energy to the nervous and immune systems. As you can see with endometriosis, there are these inflammatory markers that are elevated, but not just around, the outside of the ovary where the endometrioma might be located, but also around the digestive tract. So lowering overall inflammation is really important, and we can do that very powerfully with nutrition. We also want to support a good microbial balance, and we can talk in more detail about probiotics if you have questions about that, but it's a little bit complicated. So we want to start with probiotic foods and fibers, but we can't just add those right away if we haven't addressed the SIBO, otherwise you're just going to be more bloated. So we want to be adding in things that are going to support the good microbiome of the large intestine, but making sure we're optimizing first the function of the small intestine. And that's where we'll address SIBO, SIFO, and histamine issues for people that also have things like migraines or skin issues, eczema, things like that. And then finally, we will be more fine-tuning the prebiotics and probiotics for the microbiota, both of the gut and the vulvovaginal region, which we can do some testing for. Now, so as I just showed you, looking at a measure of the nervous system's resilience, the heart rate variability, and that quote unquote body battery, even if you kind of overstress the system nutritionally and don't get a good night of sleep and eat some bad foods, there's a lot we can do with the nervous system to mitigate the effects of that, and vice versa. If you keep feeding yourself that way, or you keep being under a lot of stress, it compounds itself in the body's ability to recover. So every time you're systemically kind of feeding your nervous system these signals of safety, you're eating lots of vegetables, hydrating, you're bringing in the minerals, you're not anemic, you have enough absorbed iron, enough absorbed B12, your sleep quality is good. You're balancing your stress with things like yoga and connection. Then it makes it easier to have a more flexible diet with less negative impact on your symptoms. The other thing that's really important is a lot of people with endometriosis struggle with anxiety, depression, and brain fog. So one of the tests we can do looks to see how healthy your brain neurotransmitter levels are. And in women with endometriosis in my practice, most commonly, if there are low neurotransmitter levels, it's low GABA which if you'll know if you have low GABA, even if you don't get tested for this, if you have kind of anxiety and physical tension. So you carry your anxiety in your body versus low serotonin anxiety, which would be more like the spinning worried thoughts in your brain. So we do have lots of strategies, both direct supplementation with certain amino acids like tryptophan if you have low serotonin anxiety, or L-theanine for low GABA anxiety, or CBD oil or other probiotics can support this, yoga. There's lots of things we can do with these low neurotransmitter levels. And if we focus on optimizing them, that feeling of calm and focus and energy can begin to prevail. And then to support the musculoskeletal system, pelvic physical therapy, amino acids and other cofactors, getting protein absorbed. I really like hydrolyzed beef protein. I've actually slowed down with giving people collagen protein. Collagen protein is good in many ways, but the problem with collagen protein is that it does not have tryptophan in it. So as I mentioned back here, it can actually deplete serotonin. It can actually deplete serotonin because there's no tryptophan in collagen. The other problem with collagen is if people are at high risk for COVID-19, which some people with endometriosis are, especially depending on where you live, collagen has the potential to worsen the kind of lung scarring of COVID-19. So I've been really cautious with supporting people with that in this current environment. But we do want to take in well and easily absorbed amino acids and their cofactors, vitamin C, zinc, manganese. We talked a lot already about viral mobilization. And my favorite motility support supplements contain artichoke and ginger, lymph drainage, dry brushing, castor oil packs. All of that can help with movement to support the immune and musculoskeletal systems. So the thing about hormones, really when I started this work in endometriosis and pelvic pain from a nutrition standpoint, I was always trying to balance hormones. But what I found over the last 10 years is that we don't have to focus so much on hormones when we optimize digestion, immunity, and nervous system function. The hormones balance themselves. And we're not really looking to create necessarily a low estrogen environment, because some of this new data we have from 2018 shows us that not all endometriosis lesions are driven by estrogen. And we need healthy estrogen, especially in the women who, I most commonly see with endometriosis who are in their teens and 20s and 30s, for brain development, for bone development, for cardiovascular health, for healthy menstrual cycles, for fertility. And so we want to balance estrogen and progesterone, but we don't necessarily want to create a low estrogen environment. What we do want to do is optimize the gut microbiome, because that will influence the health of what's called the estrobolome, which is kind of like how the gut bacteria can modulate the female hormones. And we want balance here. We don't want depletion of estrogen. We don't want depletion of progesterone. We do want proper metabolism of estrogen through the liver and through the gut, but we don't want to completely deplete. And I always recommend that people who either need a clear diagnosis for any reason, or have fertility goals, or, we do all of this and still have symptoms, to absolutely seek consult from a surgeon. And I even recommend doing it before you've tried everything else, to at least have a consultation and, see what you're dealing with. So in summary, addressing these underappreciated systems. So because endometriosis is still seen by so many people as just this, not just, but as a reproductive disease only, a lot of times these other systems are missed. And, there might be a diet out there that's looking to kind of detox estrogen per se, and that might be called the endo diet. That's not personally necessarily going to be what you need. It depends on what you need will optimize your unique digestive, immune, nervous systems, and will focus on your own culture, social needs around nutrition, your ability to recover quickly if you do something less optimal, like you travel or you go eat fish and chips, and and really understanding how your food plan impacts your own genetics and inflammation and those other markers that we talked about, gut microbiome and so forth. As these physiologic systems are optimized, whether or not you have surgery or outcomes will be improved. But we do this very often. We have a 4-month program that we do very often in concert with many of the endometriosis excision surgeons to really optimize surgical outcomes. Prior to surgery is ideal, but if we don't meet you prior to surgery, then at least after surgery. And these are day-to-day choices you can make. You can literally wear a fitness tracker. The two that we most use in our practice right now are the Garmin Vivo Smart 4 and the Oura Ring, that really can help you actively see, like, if I eat X, what does that do to my stress response? You might think dark chocolate is a healthy food, and it is for many reasons. It's high in magnesium, it's high in antioxidants, it's delicious. Dark chocolate is generally good for me, but if I ate a bowl of dark chocolate frozen yogurt, it was not dairy, it wasn't even dairy, it was dairy free, on an empty stomach in the middle of the afternoon one summer day, my stress response was not happy. And so you can learn right away what works for you. So that's been really an exciting tool that we've added to our programs. And, we don't want to get obsessive about this. Food should be social, enjoyable, delicious, nourishing. So it's not about perfection, but it's about understanding what feels best for you, optimizes your symptom picture, and so that you can make empowered choices. You may from time to time choose to eat dark chocolate anyway, or drink a cup of coffee or whatever, even if it's not your best action to take for your symptoms. But if you understand how and why that one thing might be impacting you, you can mitigate that and balance it. And that's really the goal. I want to give everyone here, if you haven't gotten it already, a free copy of Outsmart Endometriosis. There's a lot of delicious recipes in there. Go to outsmartendo.com, and I would love to have you join our Facebook group, Endometriosis Nutrition, where I post new recipes every week and encourage you guys to enjoy food, not be afraid of it. All right. Let's see. All right, Allison, I see there are probably questions here. All right. Do you want me to just dive into that?
Sure. Yeah. So we have a few questions that have shown up in the chat. One of them is from Jess. Do you have a gluten sensitivity, or are you just choosing to avoid eating gluten?
I have a gluten sensitivity personally.
Okay.
But I would recommend that most people with endometriosis will do better without gluten because of the autoimmune comorbidities that often present with endometriosis. And in general, people with autoimmunity don't do well with endometriosis with gluten, because there's so much molecular mimicry, molecular similarity to the tissues that often are attacked in autoimmunity.
Okay. And I have a question actually about the gluten piece. So there's a lot of talk about how grains or how wheat that we eat now is not the same as the wheat that we ate hundreds of years ago, or even, maybe the wheat in the United States isn't as good as, say, the wheat in other countries. Have you noticed any differences between people who you may be working with in the United States as opposed to someone who lives in Europe or someone who lives in the Middle East, for example?
Yes, I do think there is some variability in that sense. There are some people who can tolerate other ancient grains. Most people with endometriosis, especially with a lot of autoimmune comorbidities, do better without grains at all.
Okay.
Or much less grains. So there might be some degree of tolerance because there's a little bit of a balance we have to play with. Sometimes if we go really low carb, then there can be problems with like causing a increase in cortisol, increase in stress response. So if that's the case, so if no grains at all is too low carb, then usually we'll add back some grains. Quinoa is not technically a grain, although it kind of tastes like a grain, so that's a good one. Brown rice, oats that are gluten-free, millet, spelt, teff. There's all kinds of gluten-free ancient grains. Amaranth is another one that people can tolerate, maybe 3 to 4 times a week, something like that, or 3 to 5 times a week. Now, good question. Someone popped in here with what about getting a food sensitivity test? Unfortunately, essentially all food sensitivity tests are not very accurate or sensitive. So if someone has any kind of food sensitivity test and it comes up with you have 30 things that you're sensitive to, like blueberries and coconut and wheat and everything, that really is just a sign that you have leaky gut. That means that your body is reacting to food in a way it shouldn't because the lining of the small intestine is not doing its job. So because food sensitivity testing is so inaccurate, I very rarely use it. However, the one time that it can be beneficial is if someone's just completely confused about what to eat and just wants to do a 3 to 6 week kind of rest of the digestive and immune system. Then we can do a food sensitivity test, take all those things out, eat a super, super simple diet for a few weeks, and just rest those symptoms as we're actively healing them. So we're actively doing zinc and actively doing glutamine and actively trying to heal that lining, actively doing meditation and stress release and all that kind of stuff, just totally relaxing. Then that may be appropriate, but it's actually probably even more efficient to do a 3-day fast, a high quality fasting program, anywhere from 1 day to 7 days, where, you can do a juice fast or a light protein fast or, a broth fast or a water fast. That will probably reset the immune system more quickly with, a little less effort. But unfortunately, there isn't a great food sensitivity test, or I would just use it more in practice. It would be easier. So, and then back to your question of ancient grains, I definitely find some people who can tolerate sort of the ancient wheat in Europe, or less glyphosate-full, less processed. But not always. Sometimes it really is just the gluten. Other times it is probably the glyphosate or the processing. So, there are different factors to consider.
Okay, we have another question. How long before excision surgery would we stop taking supplements?
Well, it depends on what those supplements are. Like things like digestive enzymes and stomach acid, I probably wouldn't stop. Like, that's fine. Omega-3 fatty acids, there was some risk of bleeding with fish oil that people were concerned about, but and so I think with an abundance of caution,
1 week, that's fine.
I would stop taking fish oil. 9 grams of fish oil in people that have had surgery, that I would, that really showed no increased bleeding risk. So that's probably an excessively cautious recommendation, but something you might consider. And then the only other things I would be careful of is, like, if you're taking any herbs or any nutrients that might interfere with any of the drugs that you'll be given during surgery. So talk to your doctor about, are they going to be, will any of these herbs or nutrients interfere with, anesthesia or post. And you can look up, so you've listed here, Nisha, some of the things you're taking: the multivitamins, B complex, vitamin C, milk thistle. There's a database called the Natural Medicines Therapeutic Research Database, Natural Medicines Research Collaboration, where you can put in nutrients and pharmaceuticals and see if there are any dangerous interactions. So that's the database that I use in my practice. It looks like, Allison, you had a question about honey. Yes. So sugar and sweeteners are very difficult to take away because 100% of us are addicted to them, right? And the truth is, as an ultimate long-term plan, it's not realistic to say you're never going to experience the sweetness flavor. But when we're talking about kind of nutrition for recovery versus nutrition for long-term lifestyle, as much as possible, if you're in that kind of 4-month window where we're really working on this to really lower inflammation, optimize immune health, prep for surgery or recover from surgery, or prep for conception, any of those more like you're really kind of using this therapeutically, I would go no sugars, no sweeteners of any kind as much as possible. In kind of the maintenance program, where you've prepped for surgery, you've had great surgery, you've had a good recovery, maybe you got pregnant, maybe you didn't, maybe you had a baby, maybe you didn't, but you're like a year out, and now we're looking for, like, how can I live for the next 60 years comfortably and occasionally eat something sweet? Then I would say it's a little bit like alcohol. You can think of alcohol as being like a sweetener. It's basically sugar, right? So that would be an interesting thing to play with your unique HRV response. Mm-hmm. If you have one glass of wine or one drink or, one chocolate chip cookie with honey sweetened, even if it's paleo, what does that do to your HRV, and how quickly does it recover? That's really the question. And then if it spikes a little bit for 10, 15 minutes, but it's recovering, you're not really feeling effects, it doesn't mess up your sleep, depending on what time you eat it, where you are in your menstrual cycle, it's going to be better tolerated earlier in the day with other foods and in follicular phase more than in luteal phase in terms of its overall stress impact. That's when eating some healthy sweetener would be okay. Like, a couple of tablespoons here or there of honey, a glass or two of wine or other cocktail. But just recognize that anytime you have any of those things, it's a little bit of a stressor. Can we handle a little bit of stress? Yeah. You know, running is going to be a stressor too. We don't not do it, but, you know, driving to work is a stressor. So, but it's like a pleasurable stressor. So you want to make sure you're really enjoying it and that you can recover quickly. Is that helpful?
Mm-hmm. Yeah.
Excellent. Okay.
Alexandra asks, what should we avoid during our cycle?
So day one of your menstrual cycle kind of kicks off the follicular phase. And usually around day 3, estrogen and testosterone are high enough that our insulin sensitivity improves. So that kind of pre-ovulatory time, day 3 to day 14-ish on average, you are more likely to be more resilient to some of those little stressors, less resilient after ovulation up until the first day or 2 of your period. So at the right before and the first few days of the menstrual cycle, that's when I'm going to be eating as optimally as I can. More vegetables, absolutely no sugar, no alcohol, less grains, more fish oil, more olive oil, more olives, more nuts and seeds, and less occasionally nuts and seeds irritate autoimmunity. Vegetables, lots of leafy greens, cruciferous vegetables, lots of things to support liver and gut, lots of minerals. So that kind of time frame from say day, 17-ish through like day 2 of the next cycle, and when eating as optimally as possible is going to give you the bang for the buck, for your buck.
Okay. Do you have any recommendations for somebody who has chronic acid reflux, especially for someone who might want to discontinue taking proton pump inhibitors?
Yeah, so making that, usually, surprisingly enough, chronic acid reflux is a result of low stomach acid. However, if someone has been on proton pump inhibitors for a long time, further lowering their stomach acid, it's very difficult for them to really absorb and break down and absorb proteins, amino acids, and vitamin B12. But coming off those proton pump inhibitors can be really tricky. So you're usually going to have a little worsening of symptoms for a while, and we don't want to immediately give you that stomach acid support because it's just going to make that heartburn symptom worse. So what I would suggest is really cleaning up the diet, working on motility so that things are kind of flowing through well, eating in a really calm environment, really calm way, eating really slowly, chewing well, adding a little bit of apple cider vinegar or digestive bitters, digestive enzymes. Do that for a couple weeks as you're like weaning off the proton pump inhibitors, and then consider adding a little bit of betaine HCl support, but be mindful of if it worsens the heartburn. And sometimes when people, stop eating dairy and soy and grains and eat, really chew their meat, eat more fish and poultry versus a lot of red meat, or have, less, like more lean cuts of meat, really chewing it. It's just, they find it's easier to digest and you don't have as much problem. But, that would be the process of weaning off proton pump inhibitors.
Great. Thank you.
Day 1, Jess, is the first day of the period, is day 1.
Okay. And the Facebook food group name was Endometriosis Nutrition?
Yes, I think so. Let me find it real quick.
Okay.
Yeah, here it is. I'll stick it in the chat for you guys. It's actually, Endometriosis Nutrition, or Facebook/groups/Endo Nutrition.
Okay, and then just one last question before we wrap it up. What are your thoughts on seed cycling?
So I'm in almost every case very pro seed. Seeds are very high in a lot of those micro minerals that many women with endometriosis and other autoimmune issues are lacking. So I'm all for seeds: pumpkin seeds, sesame seeds, sunflower seeds, whatever. Seed cycling has no research to support it. However, anecdotally, I do see people have some improvement with it. And at the end of the day, this is one of those things that won't do any harm. If you like eating seeds at that kind of timing, it's perfectly fine. But it's not likely to have a very kind of strong effect. The only seeds I would be a little cautious of are flax seeds and chia seeds. Sometimes people with endometriosis have a sort of estrogenic response to one or both of those, especially at kind of relatively high doses in terms of seed cycling. So I'm a little cautious around that. Just notice how they impact your symptoms. But if you want to do like pumpkin seeds at one part of your cycle and sesame or sunflower at the other part, you know, I know there are different like protocols for seed cycling. There's really no downside to that, but there is also no research that it has any effect.
Okay, great. Thank you so much for joining us today. We really appreciate this discussion. I know that nutrition is one of those things that I get stressed out about. So I can imagine, you know, a lot of people do, you know, the trying to be perfect with it is really hard. So I think it's really helpful to hear that it's not about perfection. It's not about, you know, this strict specific plan, but it's really about finding out what's right for you. If people want to explore this more, where can they get help?
So they can download the book, Endometriosis, Outsmart Endometriosis, which is outsmartendo.com. They can come to the Facebook group at Endometriosis Nutrition, and at our institute, Integrative Women's Health Institute. If you land on that main website, it's just Integrative Women's Health Institute.com. On the top right-hand corner, it says there's like a little blue button that says need pain relief. You can go there and schedule a consult with our team. We have a really clear process that we've developed over the last decade. Our 4-month program in nutrition and health coaching, very supportive in making those behavior changes over the long term, helping you track your labs and your heart rate variability and your stress. And we're seeing a lot of great results with people committing to that process. So that's how you can talk to us to see if it's a good fit for you.
Great. Thank you so much for joining us today. I definitely encourage people to get a copy of Outsmart Endometriosis. It's a really great, informative read. Thank you so much.
Thanks so much for having me. It's been my pleasure.
Thank you. All right. Thank you, everyone, for joining us today. It's been great connecting with all of you. I know this is a really stressful, difficult time during a pandemic. So it's great to have these community events to connect and to be able to learn more about ways that we can cope with endo. All right. Take care, everyone.